Professor Catherine Lutz, it's a pleasure to be online with you. Thank you very much for joining us for this Quaker Council for European Affairs series of interviews on the impact of COVID-19 on peace and security and peace building. You are Professor of Anthropology and International Studies at the Watson Institute for International Studies at Brown University, but you also co-lead an initiative called the Costs of War. I wonder if you might introduce the initiative briefly before we delve into some of the deeper questions.
Great. Yeah, the Costs of War project is something that a group of us established back in 2010 in preparation for the 10th anniversary of 9/11 attacks in the US. We were concerned about how thin and inadequate the information sources were that the public had about the effects of the wars that followed that and the alternatives to those wars. So we put together a whole team of experts from around the world who had various kinds of expertise in things like the human impact on health, the impact on civil liberties and human rights, the impact on national and state local budgets, of taking care of veterans of those wars. And so we felt that that was going to be something that we in the university world and the activist world could do to provide particularly journalists, but also politicians with information that would help us come up with alternatives to this sort of endless war that has followed from that day in September of 2001.
Thank you very much, and congratulations on the initiative. You recently published an article in The Hill entitled "Fighting a Virus with the Wrong Tools," arguing that the US is unprepared to respond to this pandemic because it has invested disproportionately in the military for so long. Could you expand a little bit on this argument?
Yeah, the United States public health system is quite inadequate, in part because we have, at this point, the most recent US federal budget shows 1% has been allocated to some of these central agencies that are supposed to protect us from things like this pandemic. The Food and Drug Administration, the Centers for Disease Control, the Health and Human Services units. We also have a tremendous amount of inequality in the United States, and our federal budget does not do nearly enough to focus on the human needs in the United States, particularly of our, again, African-American population, which has been now hit disproportionately by the virus. But when you look at our military spending as a nation, it is phenomenally huge. We have currently, and if you look across units of the U.S. government, we have a $1.2 trillion investment this year in the military solutions. But ironically, of course, what this has left us unprepared to do is to deal with something that was projected to kill more people, more US citizens than have died in all of our wars. So the idea that this is where our money should have been invested is in taking care of the human well-being of our citizens, and the idea that this threat is a global threat that has no borders, right? That national security, the idea of throwing up borders is a popular idea in the U.S., but it's not one that with military guards at the gate, that again has not protected us from this virus, and particularly the most vulnerable people amongst us, the elderly, the poor, people with health conditions that have not been adequately addressed by our healthcare system. So this misinvestment, the misallocation of resources, the misidentification of where the threat really lies to human well-being, that's the fundamental problem. It is not at the point of of identifying human enemies around the world and chasing them with aircraft carriers and U.S. foreign basing, which is so extensive. It's really, again, in these questions of human health, of inequality. That's where the enemy is. And again, the problem being, looking for enemies rather than identifying the real risks to our well-being.
Thank you. And you introduced this concept of human security in your article, actually. And now you mentioned inequality and some of these areas. Is that what you understand by human security? And do you think that this this COVID-19 crisis has the potential to shift some of this thinking of security?
Well, yes, I think the future can go in one of two directions, at least. One much more positive and one much more negative. The negative first, I fear that the threat to the U.S. military and to global militaries of something like a virus, which it's taken down, for example, an aircraft carrier and multiple naval ships around the world, no doubt, not just the U.S. Naval ships. But the felling of the whole crew of the Theodore Roosevelt, a giant aircraft carrier, has led it to be brought to the island of Guam, and the sailors offloaded into the local community, which has been, created, again, both a great risk to them, but also a great risk to the sailors themselves. And so the idea that national security could be secured by a multi-trillion-dollar over the years investment in the building and running of these kinds of giant floating warships is belied by this virus, right? The vulnerability of all the humans who are on that ship is as great as it is to the civilian population. But what I'm concerned about is the focus in those stories has been on the risks to the sailors and the heroics of those sailors. And so the revalorization, the revaluing of military service can happen through the various ways in which sailors are military personnel are either felled or are shown in service to the civilian population, building field hospitals, loaning ventilators, and so on. And these stories have been in the public eye quite a bit. So I worry about the sort of remilitarization, because these are the people who have the resources. The military has its own stockpiles. It has a tremendous amount of labor available to do this work. It has field hospitals for its own use when there is a catastrophic sort of battle scene where that has to be set up. So I think, again, the problem is that this virus can result in the notion that the military needs more rather than fewer resources. The more positive story is that, again, because people can see the vulnerability, if their attention is drawn to it, that this giant institution of global militaries that have had so much money invested in them over the years, that has not protected us from mass death from this virus, and that the available resources to combat it in the civilian population are not there, and that's not right. If people can be drawn to see the way in which alternative priorities are actually that is what keeps us safe. People don't feel safe right now, and for us to draw attention to the ways in which that military spending over the years and future military spending are not going to make them more safe, but in fact less safe. Not just another world in which something else is being protected. It's a world of alternatives choices that have been made that have made us less safe. I think that is drawing those two worlds together, the world of everyday life and everyday health, and this massive investment globally in arms and militaries, that's the promise that another world is possible if those connections are made. People's own individual situations are tied into that, and they understand that their personal problems with their health are connected to these global choices that world leaders are making.
Thank you very much. One last question, turning a little bit to the responses. You've suggested in your article also to the need to rethink security and national security. We might argue that actually this rethink of security should happen on a global level, but because much of the rest of the world often looks to the US when it comes to security, I'm wondering what kind of responses would you suggest are part of this rethinking security? What would be something that the US or regional organizations like the EU could promote and put forward to address some of the security issues that you think are necessary to address today?
Okay. Well, I think one of the things that is clear is that the U.S. as a security provider is a myth that has been sold basically over many, many decades by the U.S., right? That our global military, our hundreds of bases overseas, our use of other people's land in Korea, in Guam, around the world, that provides security as opposed to creates risk. The COVID example, the bringing of the virus via U.S. Travels of U.S. service members, that's a central additional risk that people have dealt with who have U.S. security provisions in the form of basing. But even in the case of Guam, looking at the risk of having U.S. security promises, when in fact what the island of Guam is a giant target for the North Korean nuclear missiles. All right, and they've lived with this for many, many years. Right, to have a U.S. base is also to have a big target on your back. So I think understanding what those security myths are that the U.S. provides is very important as well, to see that it brings as much or more risk than it brings protection. And then again, that notion that what the U.S. could be providing is not an aircraft carrier, but public health science, public health actors and practices and products, objects that are needed to protect people from these kinds of real threats, which are in the form of viruses, in the form of malaria, in the form of various kinds of health issues that are global issues, cancers. I mean, these are all security threats to human well-being that the U.S. could be providing with its affluence, providing in shared work with other nations to again recognize that borders are not protecting people from the real risks. So that they're risks of poverty and ill health and inequality.
Thank you very much. I really appreciate you taking the time, particularly given the difficult circumstances we're all under. Thank you very much, and we look forward to continue working with you. Good luck with your initiative.
Great. Thank you so much for taking the time to talk with me about this, and good luck with all of your good work.
Thank you very much.